name is Dr. Arif Khan, and I'm a consultant pediatric neurologist and head of pediatric neurology at the American Center for Psychiatry and Neurology in Dubai. I specialize in childhood neurological conditions like epilepsy, developmental delay, migraine, cerebral palsies, headaches, autisms, and neuromuscular conditions. Today I'm going to talk to you about the specialty of childhood neurology and how it differs from adult neurology and the service we offer here in American Center for Psychiatry and Neurology for children with neurological conditions. Child neurology covers pretty much the same areas as adult neurology does, but the emphasis here is different because our emphasis is in how the neurological condition, once diagnosed, impacts on the development of the child. And therefore, a large part of what we do is developmental assessments for developmental impairments in children. Developmental delay is when a child does not reach their developmental milestones at the expected times. Delay can occur in one or many other areas in a child, or a combination of different areas, which include gross or fine motor skills, language skills, social and thinking skills. Parents are usually the first one to bring this to your attention, to the doctor's attention, that their child is not progressing as expected when they compare him or her to their peers. Sometimes your pediatrician or your GP might bring this to your attention, and sometimes it's the school that comes up with it. Developmental delay may be caused by a number of different conditions, the most common of which are genetic conditions, metabolic conditions, structural brain malformations, post-infectious problems, complications of pregnancy, or even complications at birth. Often the exact cause is not known, but however, some causes, if picked up, can be reversed, if picked up early, and therefore a thorough assessment by a pediatrician or a neurologist is essential. The other group of conditions that need to be thought of and looked for are neurodegenerative conditions, in which usually children tend to lose the skills that they already have acquired, and that's something that needs to be brought to the attention of your clinician at the earliest. Half of our clinical practice, or half of the children that enter our clinic, come in with a seizure-related condition or epilepsy. The good news here is that most of the children with a diagnosis of epilepsy are well controlled on one or two drugs or one or two medications, but 1/3 of the children with epilepsy tend to be refractory and may need non-pharmacological treatments like vagal nerve stimulators or ketogenic diet. Here at ACPN, we offer different assessment tools like standard EEGs, sleep-deprived EEGs, ambulatory EEGs with video monitoring as well. One of the other group of conditions that we come across very often in our pediatric child neurology practice is chronic childhood headaches or migraines. Not many people are aware that children can have headaches or chronic migraines, and that's something that's becoming more and more in news now, and people are picking up their children's symptoms early. We at ACPN here assess children for headaches, and by giving them headache diaries and asking them to monitor it very closely, providing them lifestyle changes which might help them control the headache symptoms, and in some cases giving them prophylactic medications to control their headaches better. So in summary, a pediatric neurologist is a diagnostic specialist and a therapeutic specialist, treating patients with medications and physical therapy. Neurologists are also cognitive specialists, where we listen to the patient and try to figure out what might be wrong with the child or a patient. And then, once we've done this, we do a thorough examination to find out where the problem might lie, helping us and helping them with future management as such. Thank you.